East African zone. And good afternoon, good morning to those that are in different time zones. You're so much welcome for today's seminar, and welcome to the AfHIRI. For those joining us for the first time, we are happy to have you and we are happy to see you. And we hope that you're going to gain a lot in this seminar. This is AfHIRI, African Health Informatics Research Institute, and we are going to be having our session 2 on strengthening access control and security in shared health information systems. We had our first session and it was successful and we learned a lot. So we felt it so much worthy to have session 2. For those who missed session 1, you're going to learn a lot and gain a lot. And as well, those who attended session 1, still you're going to gain a lot because we are going to share more about strengthening access control and security in shared health information systems. When you look at the first session we had, our facilitator, Mr. Jim, emphasized so much on ethical and legal foundations, risks in health systems, access control in practice, and security versus clinical usability. And surely we learned a lot. And today we are here on our session 2 and so expectant. I believe in the audience, we have healthcare professionals, we have those in tech, but they are building solutions for healthcare, as well those that are here and they are researchers in the same field. I believe you're going to pick one or two things in this session and you're going to apply it in your field. Maybe before we start, I would like to share a small scenario. And as well, we are going to have an interactive session, so don't keep quiet and mute your microphones. If you have a question, you're going to be writing it in the chats, and or you want to supplement something, and we let the session be interactive. Yes, before we start, I would like to share a scenario that that happened from where I work from. And I believe such a scenario, you might have seen it in your field of work or somewhere. So I happen to manage a system, an employee management system, which is tailored with biometric machines, where I had one day, I think 4 days back, one of the employees came and it is a face recognition biometric. So what he did, he took a photo, a selfie of himself and faced it to the machine, and the machine recorded attendance. But after the way the system is developed, it is giving alerts, security alerts to any kind of spam or any kind of anything that is not in line with the policy. So the system recorded that the employee had clocked in with a static photo, not a real-time capture. So if you look at such a scenario, you relate it with the healthcare now. You realize that in the healthcare, health information systems are becoming increasingly connected. And we have to ask a very important question. How do we make information more secure? Much as we are hoping, we are trying hard, like in the first session when we were sharing, and the facilitator mentioned about something very important, that they were looking for a solution of a certain problem where a patient is able to access their data. So in such a scenario, how we can ask ourselves a question: how are we? What are the measures we are supposed to put in place to make availability of information more secure in different patients. So it's one of the reasons, not actually one of the reasons, it is the reason as to why we are here for today's session. And we are so much honored to have amidst us our today's facilitator, Miss Peace Ezobi Dennis. You will correct me if I have pronounced your name not well, but yes, you're so much welcome. We are so humbled to have you, and we are so honored to have you. And we are ready to learn a lot from you. Maybe before I hand over the microphone to Peace, allow me just take you through who Peace is, and then we shall be continuing. So Peace is a biomedical and a health informatics researcher working at the intersection of biomedical science, health IT, and cloud security. She is an AI and machine learning specialist developing data-driven solutions for diagnostic, patient outcomes, and healthcare delivery. Peace has quite a number of research achievements, including neonatal sepsis prediction and improved medical image segmentation using AI models. Peace is an AI facilitator and a public health informatics researcher at the National Open University of Nigeria. She is passionate about translating AI research into practical solutions that address global health challenges and promote health equity. Ladies and gentlemen, you can use the virtual hand clap. You join me to welcome our tonight's facilitator, Mrs. Peace Ezobi Dennis. You are so much welcome. Peace, you can unmute and take us. Thank you very much. I'll stop presenting. Then you can unmute your microphone, Peace, and you.
Thank you very much for the introduction. Thank you very much, Frank. And yes, my name, you tried with the pronunciation. It's okay. So you are all, hello, can you hear me?
Yes, we can hear you, Peace. Go ahead.
Okay, great, great. You're all welcome to today's session. And I hope that by the end of the session, the topic will be much clearer. All right, let me share my screen. Okay, so can you see my screen?
Peace, we can see your screen.
All right, thank you. Okay, so today's topic is improving access control and strengthening security of health information systems. And my name is Peace Ezobi Dennis, like he had said. And Frank, thank you once again for the introduction. I hope that we are going to have an interactive section. It will not be more of a presentation. It should be a discussion. So please, you'll be dropping your responses on the chat. Okay, so these are the things we are going to cover for the presentation today. We are going to look at what health information systems are, we are going to look at why health data security matters. And we are also going to look at the common security threats that affect these systems. And we will have an understanding of access control and how it helps to avoid some of those common security threats. And then we'll look at general best practices and recommendations, then the conclusion, and have some more discussions. Okay, so on the chat, I would really like some of you, everyone to write like what they understand about health information systems so that I know that we are all together. Yes, please. I'm waiting.
Yes, members. Members, if you would like to answer the question, you can put up your hand. You can use a virtual hand up here down, and then you can put up your hand. Or if you have the answer and you would like to type in the chats, you can type in the chats.
Okay, yes, someone said health data protection. Okay. Please keep your responses coming. Okay, collect health patients' records. Yes, that's correct. Systems that manage health-related data. Thank you so much. Thank you so much. Yes, yes, yes. So that shows that the people here understand what we are talking about. All right, so yes, everyone has written what they understand and we are all on the same page. Health information systems are technological platforms. They they actually use to collect, like some of us have said, to collect, store, manage, transmit all health-related data in healthcare organizations. That's just basically what it is. And these systems are designed to support clinical care, administrative workflows, policy implementation, and even healthcare analytics. And some of the examples we have here, we have the electronic health records, the electronic medical records. And when it comes to electronic health record and electronic medical record, there are the digital version of paper-based patient record. And the EHR is a more comprehensive patient history, while the EMR is a narrower version of it. And we also have the practice management software. It's used to, sorry, can you still see my screen?
Yes, please.
Okay, thank you. Okay, so the patient and practice management software, it's actually used to manage things like patient registration, the appointment settings, scheduling, billing, things like that. So more of administrative work. And then we have the laboratory information system, which is used to manage test results. We have the radiology information system, which is used to manage imaging results. And because things are moving remotely, people are working remotely, we now have things like the telemedicine platform that is used to manage remote consultations and digital prescriptions. Now let's look at why healthcare data security matters. Why does it really matter? Why should we talk about security in terms of healthcare? That's what we'll be looking at now. And first of all, we need to understand why healthcare data are different from other industry like finance and other industry out there. Why are cyber criminals after health data because they are the number one sought after data in the black market. And then one is that the high black market value of the data. That's what cyber criminals are after. What does that mean? It means that a single medical record can sell for about 10 to 20 times more than a stolen credit card number on the dark web. So imagine selling a single healthcare data for 10 to 20 times more than any other industry. Of course, cyber criminals will want to target the health data. And then we have the high cost of remediation. Now, the cost of remediation in healthcare is almost 3 times more than that of other industries. And now you look at the life critical services that healthcare provides. When you look at it, you can see that cyber attack on healthcare affects patient safety. It affects patient care. And because of that, the healthcare organization, they are always forced to comply with paying ransoms or whatever demands that the cyber criminal are laying out. And that brings us to operational urgency. Healthcare does not want any downtime. That downtime is bad for patient care. When you bring downtime into healthcare, it means a patient's health, a particular patient health is at risk. And healthcare systems don't want that. They always want to be going on without any downtime. So the operational urgency also causes them to comply with whatever cyber attackers are saying. They are always most likely to pay ransom. Whatever ransom is asked, they are most likely to pay so that they can avoid downtime. And then we have the fragmented infrastructure. When you talk about fragmented infrastructure, one bad thing about healthcare is that we still make use of legacy systems. These legacy systems are outdated technology that are hardly patched, they're hardly updated, they're hardly fixed. So cyber criminals, they take advantage of that because it's a high attack surface for them. They can easily prey on those things. So because of that, they target health data. They target health data because they find it easy. So one advice we are going to be giving to our health practitioners that the organization as a whole need to start replacing legacy system. We need to start replacing them. We need to start using modern facilities because sometimes the use of legacy system might be that they're trying to preserve patient record or the healthcare organization cannot afford modern software, but at the end of the day, it still costs more because cyber criminals do not ask for little money when it comes to ransom. You still pay so much. So now let's look at common security threats. I would like to see what common security threats have you all experienced, like in your place of work, when it comes to healthcare systems. What common security threats have you experienced or have you heard of? Whichever one you have, the knowledge or you've experienced, I'd like to see them in the chat. I'd like to see the common security threats we are aware of, whether through experience, a place of work, or something we've read, whatever it is. Great, great, great. Yes, unauthorized access, security threat, ransomware, social engineering. Exactly. Yeah, SQL injection. That's interesting. Okay. So yes, when Frank was giving the introduction, he talked about unauthorized access and how systems detect someone using what they shouldn't be using. We'll talk about that later. But first of all, the most common security threats that we have with health information system is the unauthorized access. Now, you can have something like a former employee that their contract have been terminated. but their access, they still retain access. That can lead to unauthorized access or weak password. Let's say someone is working at the Mbara Referral Hospital and their password is Mbara. That's very weak. Like anyone can guess that. Or their password is my password 123. That's very weak. You don't use weak password, things that can be guessable, the things that are on cyber criminals brute force list. They can easily get that within seconds. Or you have issues like shared login credentials where 2 to 3 people are sharing login credentials. Excuse me. There's a tendency that that credential will be leaked out because you don't know the number of people using it. Any one of them can share it out, can give out those credentials. So it's not encouraged. And someone mentioned ransomware. Yes, ransomware attacks are the most common, where you have malware, a malware that encrypts the hospital data, and then the attackers behind it demand for payment before they can restore restore access. And then we have insider threats. Yes, insider threat is also a problem where a staff can intentionally or accidentally give out patients' record. They can do that and it's not so good. For example, when it comes to the accidental part, let's say a nurse is on her break and she's making a, let's say, a TikTok video, and she backs herself facing her phone to her computer screen. If a patient's data is on the screen still open, she can mistakenly leak that patient record to the internet. And that's an unintentional act. But an act where a staff intentionally sends out patient data from the organization out to another place, that's an intentional act. And they do happen. They are not theory, they do happen. People sell out their organization data. And another one is phishing and social engineering. I can see those ones on this chart. Yes, phishing is usually an entry point. It can lead to other attacks. It's where you have you receive all these deceptive emails or calls that trick staff to review their credentials. So something like that can lead to ransomware attack and other attacks out there. And then because of the use of a broad adoption of cloud. Everyone wants to move to cloud these days, and because of that, we have what we call the cloud misconfigurations, and those misconfigurations lead to data exposure because, like for AWS now, we have a storage we call the S3 bucket. Now, if you have something like the S3 bucket and you're in a rush trying to set up things and you don't put proper policies in place, you just put a broad policy. Anyone on the internet can access what is in your storage, and that's not the intention. So such misconfiguration can lead to data exposure. So we need mature governance. You need to make sure that your policy are tight so that you don't accidentally expose your data. And I know that some of us, in fact, all of us have heard of Internet of Things, right? Yes, Internet of Things where you have your devices being connected to the internet and all of that. Now we also have the Internet of Medical Things, and they come with their own vulnerabilities, where you have devices like the insulin pumps, imaging machines, all connected to the internet. The downside of this thing is that they lack robust security controls, and cyber criminals, they know this and they try to prey on it. And we have so much, yes, intrusion, denial of service, DOS. Those are common, but since we have other things to talk about, we just keep this low. Thank you for your participation. Okay, so now let's look at access control. Let's try to understand what access control is. So I will love it if you can put in the chat what you understand by access control. Yes, please. Let's see. What do we understand by access control? Putting measures on who has access to what in a system. Yes. Right person get right access. Exactly true. Everyone is correct. Yes, yes. All right, thank you. Authorized login. Yes, authorized login, true. All right, so yes, we are all correct. And access control is all of what we've said. So it's limiting access. When you limit access to resources or systems, information, when you limit access to it, that is access control. And like we all said, so when someone gets the right access, when we are authorized to do, they are all access control. So what's the importance of access control? Access control prevents unauthorized access to data, and they help us to comply to industry regulatory standards like the GDPR, the HIPAA, PCI, DSS, and their likes. And then they also help us to protect our data. Protect in the sense that the confidentiality, the integrity, and availability of that data is protected. And in cybersecurity, we call this the CIA triad. Now let's see how access control works. So I would like to play a little bit with your imagination. So let's imagine that you are logged out of your Facebook account or your LinkedIn account, and you're trying to log back in. What's the first thing you do? The first thing you do is to put in your username, and that's the identification. When you put in your username, that's identification, the first step. The next thing is for the system to verify your identity, right? And to do that, you have to put in something like your password. Okay, you need to put in something like your password. And after you put in your password, you're going to put in something you have, because your password is something you know. You need to put something you have, like your token. Let's say your authenticator app token or a token sent to you by SMS, or you make use of your biometric. These days, everyone is using biometric because it's much easier. And after the authentication, you move to authorization. Now, authorization is where permission is being granted, and your permission is given based on your role. If you are a user, you get a user permission. If you're an admin, you get an admin permission. Nothing more, nothing less. And after authorization, it moves you to accountability. Here, all of your activities are being logged, and they are traceable in case there's a breach or they need to audit it. And if you go to your Facebook or your LinkedIn app, you can see there's a place where they have the activity. If you check activity, you're going to see the things you've been doing. If some of those activities are not what you've done, you can report them that they are not yours, and investigation can be carried out to know if your account have been hacked or something. So since we've understand how authentication access control works, let's see the types. Let's try to understand types of access control. First, we have the discretionary access control. Here, let's say the resource owner, it just gives access on their will, like whatever they want at their own discretion. So assuming I am a resource owner, I can decide that, hey, Frank, you are the admin today. Oh, Irene, you are the assistant tomorrow, and all of that. I just give access based on my own conviction, based on my own will. It is very flexible. Like you can see, like when you just wake up, you give this person access, tomorrow you give the next person access. Nobody is questioning you. It is your free will. But as flexible as this is, it comes with high risks, because you can give someone permission beyond what they need or what they require. So there can be mismanagement of permission. This is not actually advisable in in a place where there are sensitive data. It's not advisable to use this discretionary access control. And then we have the mandatory access control. This one is different from the discretionary. Access is not given by just the resource owner waking up, sharing out access. No, it is done by a central authority that controls access, and it does this by giving security labels. And because of how tight this access control is, it is used in the government and even the military. So how does it work? Well, I think some of us might have seen where in the military, they say a data or information, whatever resources it is classified. That's a security label. So the person that needs to open that resources and the resources itself, they are under the label classified. So anybody that is not under that label, does not have that classified label, cannot view whatever information is there. So that's how mandatory access control works. And then we have the role-based access control. This one simplifies management because access is tied to role. If you are the admin, you get admin. If you are the CEO, you get CEO access. If you are promoted, access is given, you inherit access to the position you are going to. Your HR is not coming to say, oh yeah, take this access, no, you are inheriting whatever promotion role you are getting. So it simplifies management, especially in large organization. And then we have the attribute base, like the name. It makes use of multiple attributes like role, time, location to say, okay, this is who will have access and when and all of that. So for example, let's say a doctor working at the referral hospital. The doctor does not work in the emergency department. Let's say an ENT doctor. So you can give that doctor a time frame of, let's say 7 a.m. to 7 p.m. That's the only time they can access that system. And so what will happen is, and the location will be Uganda, of course, because that's where they are working. If the doctor uses a VPN that changes their location, even though they are still in Uganda, as long as their location is not tallying with what is on that attribute, they will not be able to get the access required. And then if they try to access the system earlier than the time or later, maybe by 8 p.m., they will not be able to access that system because the attributes do not correspond. And that's how attribute-based works. And then the rule-based. The rule-based is close to the attribute-based, but the difference is that organizations can write, it's more of policy. They can write out the policy to fit what the organization needs, what the hospital needs at the moment. So it's more adjustable than attribute-based. That's just the difference. And then we can now look at the implementation best practices for access control. Now, first of all, you need to identify your assets. Talking about identify your assets, you need to know what you define as sensitive. What is the sensitive data or application, whatever it is you want to protect, you need to know them because you can't treat all your data, all your information, all your resources alike. One must be much more important than the other. So you need to identify your assets and know which ones are sensitive. Two, you need to adopt the RBAC access control, which is the role-based access control. Why? Because it helps you to tie access to roles and not individuals. So if someone is leaving or someone gets promoted, you don't go through the manual stretch of giving them access or trying to take away access. It happens automatic because the access is tied to the role, not the individual. And then we have the strong authentication. You need to enforce MFA, multi-factor authenticator. Always combine password with something else like biometric or tokens. And the best is usually hardware tokens. Hardware tokens because they are hardly cracked. And then we have the least privilege principle. Now, principle of least privilege has to do with giving the only access required to perform a specific task, nothing less, nothing more. That is the principle. You don't give more than what people need. If someone needs to access an admin role for 1 hour, you cannot give them that role beyond 1 hour because you'll be violating the principle of least privilege. So it is you giving the only access required to perform a specific task. And again, we have the monitor and audit. Now, when you monitor, like the example Frank gave when he started the introduction, he said that he mentioned something that the system was able to detect what the employee did. The system was only able to detect that because they were monitoring. Without monitoring, there's no way they would have known. And for the organization to even be aware is because they audited that log. You cannot, even if you monitor and you have all the logs, unless you audit, there's no way you will know. So you need to audit those logs to know that, okay, this actually happened and this is why it happened. And then you can start investigation and all of that. And we have the educate employees. Your employees are your front line of defense. So in hospitals, we need to train the doctors, the nurses. They are not just there to treat the patient. They're also now at the age where we are, where internet is everywhere. They need to protect both the patient's health and the patient's information. So now patient safety goes beyond the physical. So we need to educate everyone. They need to be cyber aware so they can know things like they're not supposed to share their access credentials, that when they get an email, they need to pause. If they need to even confirm, they should go and confirm from the IT department before clicking. You don't just go and click things because they are clickable. No, you have to take a pause. And that's the best practices that can help put up a good access control system. Now, let's take a rundown on the benefits of this access control. Access control will help you enhance security. Why? Because it will protect your sensitive information. When there's strict access control, your sensitive informations will be protected. Next is that it will help you comply with industry regulatory standards. And the third one is it will help you improve operational efficiency. Like when you make use of RBAC, the role-based access control, things become automated. When a contract is terminated, an employee contract is terminated, their access is terminated immediately also. When an employee is promoted, they inherit the access. You don't go and start doing manual work. So it's improve operational efficiency and also audit and accountability. Like we said, when you have good access control system, your monitoring will become something that is always there, monitoring and audit. So you maintain detailed logs of who has access, where they had the access, when they had the access. Someone is saying, no, I did not log into this system. I did not send that data. They can swear all they like, but the logs are there to tell us if they truly did it or not. So now we're going to look at general best practices and recommendations that can help our healthcare systems. And number one is implement zero trust architecture. I don't know if some of you know what zero trust is, but zero trust tells us that never trust, always verify. So let me give an example. Let's say someone comes into a very big mansion and they pass through the security gate, the security at the gate, and they got into the compound. The fact that they are inside the compound does not mean they have access to the living room. When they get to the main door, they are going to verify again before they get into the living room. And when they get to the living room, they are still going to verify if they want to go into the kitchen. And let's say they come out of the kitchen and want to go back to the kitchen. They are still going to verify again before they enter the kitchen. That is zero trust. Like it has zero trust that you've entered a particular, you sign into a particular area of the application does not mean that when you come out does not mean that the access is still there. You still need to verify. That is zero trust for you. And it helps to calm down what cyber attackers can do on your system when they get access to your system. And then we have the conduct periodic access reviews. This is very important. It's actually advisable to do it quarterly, not yearly. Annually, you can just make you miss out some things. But when you do it quarterly, you get to see if let's say your automated system broke down, you will catch it early. In a matter of months, you get to know what is happening. But when you keep your periodic access review to annual as reviews, you fail to see the things will go to like they will go so bad before you even know that things are going bad. And then we have the apply network segmentation. Here, like when we talk about the implementation, we said that you should identify your asset. Now, when you identify your asset, inside sensitive, we still have things that are critically sensitive. You need to know the things that need internet access, things that you don't want people on the internet to have access to. You isolate them. You segment them away from the things that you want people to have access to. So that is the importance of applying network segmentation, separating the things that you don't want internet connection to, or you don't want things to be talking to them from the internet, you separate them. And next, we have the enforce strong password policy. This one is very important. And don't forget, after you enforce the strong password policy, please also enforce MFA to all the system, because time will come that MFA is going to be the only thing between the cyber attacker and your resources. That MFA will be the thing standing between the attacker and your resources. So MFA is very important. And next is the data encryption. Whether your data is in storage, that is at rest, or your data is in transit, like in transmission, you need to encrypt it. You need to encrypt it because we have, like when your data is in transmission, we have what we call the man in the middle. Man in the middle is when attackers try to intercept traffic. When they intercept it, if your data is not encrypted, they are going to see everything as clear as day. But when it is encrypted, all they get is an encrypted data, which will not be meaningful to them. And another one is for you to have regular security audits and pen testing. Yes, you might have put everything in place and think, oh, yes, my house is well, my hospital is well covered and all. You need attackers, ethical attackers to verify those things that, okay, these things are actually working the way they should. So that if there's something that people, your security people missed, they will catch it early. Because if the black ones get it, if the attackers out there looking for ransom, when they get it, they're not going to smile at you. So it's good to get those ethical hackers to verify things for you. And also we have the incident response planning. Incident response planning has to do with you developing a document that tells, okay, this is what we are going to do when a breach happens to us. Yes, I know you've placed everything, you put everything in place, all the security measures are intact. We know that, but even the most sophisticated organizations today have been breached at some point. So you need to know that no matter what you do, there might be someone out there might be an attacker that is so good enough that they will break whatever you've put in place. Okay. So to make sure you put those things in place, because when the breach happens, that's not the time for you to start writing down what to do. You'll be too overwhelmed to even think or plan at that moment. So it's good to have a document that tells everyone what they're supposed to be doing in such scenario. And then we have the continuous monitoring and audit log. As much as it's good to conduct periodic access reviews, you need to have continuous monitoring and audit logs, because these ones, they catch errors immediately, real time. They catch errors real time. So it's good to have continuous monitoring, they give you eyes on your systems. And when you audit them, you get to know what's happening in the house. And number 9, we have the tested backups. We have the tested backups. Now, it's good to maintain regular backups. It's good for you to have backups, but please, you need to test those backups. And make sure they are stored in a separate location from the data resources you are using at the moment. They should be in a separate location so that when there's a compromise to what you're using at the moment, you have a clean backup to restore from. And you need to test them to be sure that they are working. And then we have the established vendor risk management. Now, there's some organizations, there's some hospitals that they were not attacked. They were not breached based on their own security failure. They were breached because of the third party they worked with, because of the plugins they used. So you need to be mindful of the third party vendors you are working with. Be mindful of their own security. Be mindful of the plugins you are using, like our developers. They just tell this plugin is to help you do this, but you just go there and click and install. You have to be mindful, make your own research before you install those plugins, because they can come with security risks. And then we have the staff training and awareness. I've mentioned this before, and it's very important. Train your staffs so that they don't go on missing little things. Because there was a breach last year. What happened? A staff just clicked a link, and that was the end of it. Sorry, can you still see my screen?
Yes, please. We can see your screen. Please go ahead. Thank you.
Okay. So staff training and awareness is important. And that brings us to the conclusion and some call to action. Now, after all we've said today, please audit. If you're working with health information system, go and audit the current access control policies. Know who has access to what. Know what they're having access to and when they have access to. Keep an eye on the systems and implement MFA across those health information systems. Let people have MFA. Let MFA help improve your security. And also train all staff on security awareness. And it should not be a one-time training. It should be a recurring training. Maybe it can be quarterly. Test the training also, see if they are catching up with the awareness. Because there was a time that we tested some employees, and it was what was used was the salary increment thing. It was during payment period, and then tested like, oh, you have a salary increment, click this link to do this and that. And almost everybody was clicking the link. Nobody came to verify if it's really from the management or not. They're just clicking the link. So you need to also carry out those blind testing to see if the staffs are really catching up with the training. And then we have the develop or update your incident response plan, because if you don't have one, please go and develop one. If you have, go and audit it and update it. And ensure that you comply to industry regulatory standards like HIPAA or whatever regulatory standards that is in your country. Like in Nigeria, we have the NDPR. I think in Uganda, it is the Data Privacy and Protection Act. So we need to comply with them. And also, we need to prioritize system patching. Always update systems. Keep them up to date and replace legacy system. In healthcare, we need to start replacing legacy systems. And now it's time to see how much we have absorbed from all the talks I've been given. So I have some scenarios here that I would like us to walk through together. You will be dropping your responses in the chat, or if you want to speak, it's fine. So number one scenario has to do with an incidence of unauthorized access. A nurse who was recently terminated from a hospital still has active credentials to the EHR system. 3 weeks after departure, unusual login activity is detected at 2 a.m. from her IP, home IP. Now, what failure allowed this? And what should have been done at the time of termination? Please drop in your thoughts. Let's see. Yes, keep your response coming. Okay, RBAC failure. I think since Haro was removed, access to should have been deactivated. Yes, that's correct. Access should have been deactivated. Yes. Yes, keep your thoughts coming. Okay, so let's solve it all together. So what actually failed here is the offboarding protocols and access revocation failure. Like during the offboarding protocol, it should have included access revocation. So the revocation failed. A failure of it is what allowed her to have access to that system. And what should have been done at the time of termination is immediate access revocation. Is it Linda said, her access should have been deactivated. It should have been deactivated immediately. So number two, the ransomware strike. A hospital receptionist clicks a link in an email that appears to be from the IT department, asking her to verify her login. Within hours, the hospital's patient management system is locked and a ransom note appears on every workstation. What type of attack is this? 2, name 2 controls that could have prevented it. And 3 steps that the hospital should take right now. Yeah, malware. Okay. Okay. Yes, exactly. True. Ransomware. Invalid dynamic link for the form issue. Okay. Ransomware attack. Yes. 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 Phishing attack. I'm good. That shows that we are all catching up. That's true. Okay, so yes, we are all correct. First of all, it started with phishing. The link she got, she clicked on, that's phishing. The email she got and clicked the link, that's phishing. And the phishing led to ransomware attack. So whether you say phishing, ransomware, you're all right, you're on the right track. And the 2 controls that would have prevented this is if they had enforced MFA, the MFA would have been something that stands between the cyber attacker and the resources, because they got her login credentials through the link they sent. But if she had MFA on that account, they wouldn't have been able to access whatever access she was given. And then the three steps that the hospital should take right now is first to activate their incident response. Remember when I talked about incident response, it's the document that tells you what you are going to do in such scenario. So they need to activate their incident response. Everybody knows what they are supposed to do. And then they need to reset the compromised credentials, because let's say they jump to restore backups. If they restore their backups when they still have compromised credentials, the backup will still be compromised because the attackers will still be inside. So they need to first reset the compromised credential, make sure that their system are clean before they restore anything. And they're restoring tested backups, not just backup, because they need to be sure that this backup is already working. And that's it. And the last scenario, this has to do with overprivileged doctor. During a routine audit, it is discovered that a radiologist has admin level access to the billing system, lab records, and pharmacy database, far beyond what her role requires. She was granted this access temporarily 2 years ago, and it was never reviewed. Which access control principle was violated? Which access control model would best prevent this? What would have caught this earlier? So let's see. Perfect. Mary. Mary is our first winner. Principle of least privilege. Exactly. Okay, keep your answers rolling in. Best model violated RBAC. Okay. Yes, the best model to use is exactly what you said, RBAC. Yes, yes. Yeah, we have our second winner. Who's going to answer our third one? Yay! Frank wants to take everything. Yeah, yes. Thank you so much for participating. Okay, yes. Which access control policy and principle was violated? Like Mary said, it is the principle of least privilege. And which access control model would best prevent this? And like Frank said, RBAC, the role-based access control, it would have prevented this, because role-based would just give her the access that a radiologist should have, nothing more and nothing less. And also, what would have caught this earlier? Frank and Mary said audit logs. Yes, the first thing that would have even caught it real time would have been continuous monitoring and audit logs, like you said. And if that wasn't possible, you can still use the periodic access review. Periodic access review will catch it in months, not in years. It won't have stayed up to years. It will just catch it in months. But the continuous monitoring and audit logs will catch it immediately. So thank you so much for participating. This is the end of the presentation. You can drop in your questions and we can continue the discussion. Thank you for your time. Thank you for listening. Thank you for participating.
Wow. Thank you very much, Peace. Can we give a hand clap to Peace for what we have learned today? Let's appreciate her, please. Yes, thank you very much. We are now welcoming questions. If you have a question, you can put up your hand or you can type it in the chats. For the interest of time, we are going to take 3 questions from the audience. So if you are in the audience and you have a question, or something to add on, or something specific you want to ask concerning what Peace has shared, it is very welcome. You can put up your hand, you can type it in chats. It is very welcome. Maybe Peace, before you leave. Okay, no, not leaving. You can leave the slides. I have a question. As the audience is prepared, they are preparing themselves and preparing their questions. My question is about the best practices of access control you have shared. I have a small scenario and I need an answer from an expert like you. So take an example of a healthcare professional. Maybe they are having a small healthcare facility somewhere with a limited cybersecurity budget. What are the most important access control measures they should prioritize first to protect patient information? Yeah, from what you have shared, I have a healthcare facility somewhere and I have a very small budget. What could be the best practices I could prioritize to make sure that the patient data or information is secure? Yeah, thank you very much. As you answer that, we shall be getting the questions from the audience. Thank you.
Okay, thank you so much for your question. That's a very practical one. Okay, so before I can answer that question, I would like to know, are you making use of any cloud-based providers?
Yes.
Okay, so if you're making use of cloud providers, there is what we call the IMA, the IAM, which is the identity and management. Now, it helps you to fine-grain the people who can have access to your resources. Once you're making use of a cloud provider, you can make use of that provision there. Make sure that the IAM is well implemented so that your access to things if you is it AWS or Microsoft or Google? So because whichever one, you can actually do that. If it's for AWS, you when you go to the IAM session of the cloud settings, you'll be able to see what resources you can give provision to. They can even write policies for them. And the policies can state that this is who can have this, or this is what can have access to this. And under the policy, you can make it like the airbag. You give access to roles. So whoever is inheriting that role will get that access. But if you give the access to individuals, it becomes complicated issue. It be an complicated issue. So you give access to the role. There's a provision for that in your policy when you are writing it. And if it's Microsoft also have where you make those policies also in their this identity and identity session also. So, and a good thing with Microsoft is that although every one of them have their own good sides, so when it comes to Microsoft, they provision almost everything for you, like the way it will be useful to you. But when it comes to AWS will want you to define it yourself. Like you need to put the things in place. It's like somebody giving you a wood, a nail, and and then a hammer and tell you, oh yeah, fix it. But with Microsoft will now give you the table itself. They will not ask you to build the table, they will give you the table. So it depends on what you are doing. If you think you can build things by yourself, AWS works for you. You can build the things from ground up. But if it's you want something that is already built, then you can use Microsoft. Microsoft will provide almost everything you need to make sure that your identity management is seamless. And don't forget, implement MFA. As simple as it sounds, it's usually the thing that stands between criminals and your resources. Because your credentials, no matter how strong they are, at some point they can be cracked. But if you're using MFA, at least you know that that one is going to stay. When they ask us to verify, it means they cannot get into that system without the verification. So no matter, even if you are still a small facility, make sure you are making use of MFA. Make sure that you have a strong password policy. People should not be using things that anyone can guess. Because cyber criminals, they have this long list, what they call the word list. When they put that word list and start using some tools like John the Cracker, they will crack things in minutes and seconds. So you don't use things that are predictable. You do those combination of words, um, words, numbers, the special characters, and make them like passphrase. Passphrase are actually hard to crack because they take longer time. Sometimes it can even take days and all, so they can give up on those ones. But so that's the thing I can say for now. Since you're a small district, make sure your password policies are strong. You're using MFA, and if you're using cloud providers, make sure you are making use of their IAM very well. That's what I can say.
Wow, thank you very much. Thank you so much. Yeah, I have learned a lot. Is there any question from the audience? Yes, I'm waiting for the hand. Yeah, if I ask one more question, that means we are remaining with one question from the audience. So if you have a question from the audience, you can raise up your hand as early as possible. Yes, Peace, I have another question that has been ringing in my head when you shared something about implementing zero trust architecture. Maybe you can go to that slide down. I think it is slide 15. Then I can ask my question. Yes, thank you. Now, in this case, we on this call we have many researchers that are here, and they have done research in health care, and they are still doing research in healthcare. And we are so privileged that you are one of those people that are actually doing research. So in this case, we happen to have researchers who need access to patient data or to health data from institutions. So what could be the best way of giving out, or of making that data available for researchers, but then still we ensure security and we ensure confidentiality? What could be the way of doing that? Thank you very much. Like, think it in this perspective of a researcher who needs a certain patient data from a certain maybe healthcare institution. How can we share that data, and we are still ensuring confidentiality, we are still ensuring ethical and legal foundations, also considering the risks in that? Thank you very much.
Right. Thank you, Frank, for your questions. I really love them because there are things that we do almost in our everyday life. And what I would say about that is when it comes to sharing of data, it's advice and research that you make your data available so that people can recreate your work. Now, for you to actually do that, you need to strip off that data of anything identifiable, anything that can identify the owner. You need to strip off those things out. I can give an example. an issue that happened, an incident that happened in the US. A company did a research and made the data available. Now they removed things like name and just some serial numbers, but they left other things that people could put together, some pieces that people could put together to know who owns a data. And within some time, the people in a particular area could tell who owns a particular data, and it was a health data. People could tell what is happening on that data. They had to bring it down, and HIPAA find that organization. Why? Because the data was not stripped out of the identification things that if people put together, they'll be able to tell that, okay, this data belongs to Frank. The number of the house, the area, they put them together. Like, how do you make such data available on the internet without stripping the things that people can tell that it belongs to Frank, it belongs to Peace, it belongs, you need to make sure that the data you are collecting, first of all, you are collecting them as anonymized data. And not just that you are removing their names and saying they are already or no. You need to make sure you look through those data, and there is nothing in that data that would point to the owner. That's the best way for you to say, okay, this data has been anonymized, that nobody can know that it belongs to this person. Otherwise, in the long run, if people could tell that this data belongs, you'll be fined for it. HIPAA is out there because they are out there to protect patient safety and patient information. So even if, and research ethics will also come out for you. So you need to make sure that the data does not have anything that can identify the owner. That's the best practice.
Wow. Thank you very much. For researchers who are here, I believe they have answered the question. If you still felt like there is something you need her to talk about, you can type it as she's answering this question, because I realize we have a lot of researchers on the call, and maybe when I ask you the question, I just see through something in their head. So if you have, I will take one question like related to the research and data sharing. Yes. Someone is
Sorry,
asking.
Frank, sorry, there's a question in the chat, but I think the person should rephrase, or you can read, if you understand it, you can read it for me. I don't seem to get the question in full.
There is asking, but these days the high rate of cracking is too high that the modernized technology can be cyber. And okay, you can I think rephrase the question first, because we are not getting it well. We are only getting the last part. In what minimal way can we prevent it from coming? So maybe you can rephrase the question, dear, such that we can get it very well. Thank you. Yes. More questions? Okay. Maybe he meant cyber-centered. Is it what you meant? If you're still on the call, you can unmute. You can unmute and maybe you ask it on the.
Okay, thank you, Mr. Frank.
Yes, sir.
Now, my question is that the question is, I was trying to say that with the current modernized technology, the rate at which cyber tracking is developing is faster. At the same time at which it can be tracked is also faster. And yet we say that somewhere they say that in cyber security, information can be 100% secure. But if I know that the more the cyber security is developing, the more also the hacking of its system is also developing. Now, how can we prevent the data which is there? How can it be prevented from being tracked by other people who are going to use it in the wrong way?
Okay, thank you so much for your question. Okay, yes, your question is correct, but there is no 100% security anywhere. Not even AI now can bring it. There's no 100% security out there. So that's why if you listen to my presentation, I said you still need to have what we call the incident response plan because you can't say you can never get breached because even Google has been breached, AWS have been breached. In fact, last year it was breached. So you see that even the strong ones are being breached despite the number of security personnel they have in their organization. So there's no 100% security. And with the rise of AI, the attackers are becoming sophisticated because they are now using AI, they are automating their attacks. It's no longer manual. The attacks, maybe before they could carry out 10 attacks a day, but now they are carrying out about 100 attacks a day because they are automating everything. So, and what I would say is that the black hackers, they are rising faster than we can even protect our information. They're rising faster than we can protect our information. So that's the chaos out there. That's the chaos out there. So the best thing is to keep trying to make sure that you're using the best practices, implementing best practices, and well, you hope that you are not the next target because that best practice is the first thing you do. Make sure you are playing your own part very well. And remember, I mentioned something like make sure you call ethical hackers to test those things. You might be thinking that the things you've put in place are strong enough, but when you call an ethical hacker to test them, you will see some failures. So no matter the best practice you put in, call an ethical hacker to test your system. An ethical hacker that knows what they are doing to test your system so that because they are going to think like that hacker that wants to ask you for ransom. And they're also going to use automated system if you allow them. But most organizations don't like ethical hackers using automated system because it causes what we call the DOS, the denial of service, and it makes their systems to break down, especially those that allow attacks on their live resources. So that's just what is out there. The black hackers are really growing stronger by the day with AI.
Wow, thank you very much. Thank you very much. Thank you very much, Peace. I think at this point we are not taking any more questions. Maybe let me check the chats. There are no questions. Yes. Thank you very much, Peace. We are so much humbled for such an informative session. Can we appreciate Peace one more time? Yes. I've shared something in the chats. We have our social media for doctoral researchers. Oh, at AfHIRI, we always conduct something called the Postdoctoral Researchers Progress Forum. For those who are here and your PhD students and you would like to share, to present your research, you're always welcome. You can register with us. You can join our WhatsApp group in that link that I have shared in the chats. You can tap in that link and you join our WhatsApp group for the doctoral forum. Yeah, and presenting at the forum, you can register on the link that is below, that link that is via our website. Yes, thank you very much, each and everyone, for attending this informative session. Thank you very much, Peace. We have learned a lot. Thank you so much. And you are welcome again to attend another virtual seminar we shall communicate. Yes, allow me to, well, before I hand over, my name is Frank Kalembeli. I have been the moderator of today. Thank you very much. Allow me invite Linda to give us closing remarks and we shall be out of this place. Thank you very much. Linda, you're welcome.
Okay, great. Thank you so much, Frank. Hi, everyone. Amazing session. I believe we've learned something. I'm actually still contemplating on the call of action that Peace has given us that has been really informative. So thank you so much, Peace. And to our dear moderator, of course, Frank, thank you for holding the room so well and also for keeping the conversation flowing. So members, if you can see in the chat space, we have put a link for you to give us some feedback. That will really be important for us to see how we can shape, of course, the next sessions that we'll have. And of course, the way Frank has mentioned, we look forward to seeing you both on the doctoral forum that we have and also for the sessions that are coming up. Thank you for everyone who has contributed, those ones who have asked questions, those who have added on. We call you our real MVPs. So thank you for those contributions. At least you're always making these sessions to feel like a conversation rather than a presentation, because for us at AfHIRI, one of the things that really matters is that we don't want just to bring things that we think to you, but also for you to make suggestions, and then we see how we can make a community that not only listens but also shares their experiences, asks questions, so that we see how we can grow together. Once again, thank you, Peace, and we hope to see you in our next sessions. And of course, if we have any slot for you to come back on and expound more. I know the questions have been many, but I also know that there are more information and informative lessons that you can pass on to us. And also to our dear members, I know it's a Friday. I myself am at home, and I'm in this time I would actually be maybe on Netflix and chill. But the fact that you've spared this 1 hour and a half to be on this call, we really appreciate you, and we look forward to seeing you next month for another webinar that we are going to have. And let's keep up the spirit and learn from each other. But with that said, I say good night, happy weekend, and keep safe wherever you are. Thank you.
Yeah, thank you all for your time. Thank you for participating.
Thank you. Bye.